Imagine waking up one morning feeling your face suddenly droop, your speech slurs, or your vision blurs for just a few minutes. You might shrug it off, thinking it's just fatigue or aging catching up. But what if I told you these fleeting moments are your brain's urgent warning, a mini stroke knocking at your door? Ignoring these signs could cost you or your loved ones a life forever changed by a major stroke. Every year, hundreds of thousands of older adults experience these silent alarms called transient ischemic attacks, or TIAs. They're brief, subtle, and easy to miss. But make no mistake, they are urgent red flags signaling danger ahead. In this video, we'll uncover the 8 critical signs of mini strokes that every family should know. From sudden numbness to dizziness, these warning signals could save your life or that of someone you love. Stay with me because awareness and quick action are the keys to prevention and hope. 1. What is a mini stroke TIA? Today, let's start by understanding something very important but often misunderstood: the mini stroke, medically known as a transient ischemic attack, or TIA for short. Imagine your brain as a bustling city powered by constant deliveries of oxygen and nutrients through blood vessels, like roads delivering essential supplies. Now, picture a sudden traffic jam on one of those roads, causing a brief interruption of the delivery trucks. This disruption is what happens during a TIA. The blood flow to a part of the brain is temporarily blocked or reduced. Unlike a full-blown stroke, which can cause permanent damage to the brain, a mini stroke is fleeting. The blockage clears up quickly, usually within minutes to a few hours, and the symptoms vanish without leaving lasting harm. But here's the catch. That short traffic jam is a warning sign that a bigger, more dangerous blockage might be on its way. Let me tell you about John, a 68-year-old retired teacher from Ohio. One day, he experienced sudden weakness on the right side of his face and arm. It lasted only about 15 minutes. John thought it was just fatigue or stress and didn't seek medical attention. 2 weeks later, he suffered a major stroke that left him unable to speak clearly and needing months of rehabilitation. John's story is a powerful reminder. Even if symptoms disappear quickly, they are your body's urgent way of signaling a problem. Ignoring a mini stroke is like ignoring the flashing red light on your car's dashboard. It's not a minor issue, it's a call for immediate action. Understanding TIA is the first step toward prevention. It tells us that the brain's roads are vulnerable, and if left unchecked, a major stroke could cause serious, permanent damage. So when you or someone you love experiences sudden neurological symptoms, even if they resolve quickly, treat them as a medical emergency. In the next parts, we'll explore why older adults are more prone to TIA, what warning signs to watch for, and how timely intervention can save lives. 2. Why are older adults more prone to TIA and stroke? Now that we understand what a mini stroke or TIA is, let's talk about why older adults, like many of our beloved grandparents or parents, are more vulnerable to experiencing these episodes. As we age, our bodies naturally undergo changes, some visible, like wrinkles or gray hair, and others hidden, like what's happening inside our blood vessels and brain. Imagine your blood vessels as flexible garden hoses. When you're young, they're supple and elastic, able to expand and contract easily to accommodate blood flow. But over time, these hoses can become stiff, narrow, or clogged, much like an old pipe that's developed buildup inside. This stiffening and narrowing of blood vessels is called atherosclerosis, or more simply, hardening of the arteries. It happens when fatty deposits, cholesterol, and calcium accumulate along the walls of your arteries. For older adults, this is especially common because of years of exposure to risk factors like poor diet, lack of exercise, high blood pressure, and smoking. Let me introduce you to Mary, a 74-year-old woman from Michigan. Mary loved her morning walks and cooking family meals, but didn't realize that her high blood pressure was quietly damaging her arteries. She never felt unwell until she suddenly experienced dizziness and weakness, Signs of a TIA. After a thorough checkup, her doctor explained that the hardening and narrowing of her arteries had reduced blood flow to her brain, increasing her risk for stroke. Apart from atherosclerosis, there are other age-related factors that increase TIA risk. High blood pressure, hypertension. Often called the silent killer, high blood pressure puts extra strain on arteries, making them more prone to damage and rupture. The higher the pressure, the harder the heart has to work, and the more likely arteries get injured. Atrial fibrillation, AFib. This common heart rhythm disorder becomes more frequent with age. It causes irregular heartbeat and can lead to blood clots forming in the heart. These clots can travel to the brain, blocking blood flow and triggering a stroke or TIA. Diabetes. High blood sugar levels damage blood vessels over time, accelerating atherosclerosis and increasing the risk of clots. Other health conditions. Chronic kidney disease, high cholesterol, obesity, and sleep apnea all contribute to poor vascular health. Lifestyle factors. Physical inactivity, smoking, excessive alcohol intake, and poor nutrition further amplify the risk. It's important to understand that aging itself doesn't cause TIA or stroke. Rather, it's the accumulation of health issues and lifestyle habits over time that put older adults at greater risk. The good news: many of these risk factors can be managed or even reversed with medical care and lifestyle changes. Early detection through regular checkups, blood pressure control, heart rhythm monitoring, and a healthy lifestyle are powerful tools to keep the roads to your brain clear and open. Remember, just like Mary, you or your loved ones can take proactive steps to reduce risk and stay healthy well into your golden years. 3. The 8 warning signs of mini-stroke (TIA) in older adults. Now that we know why older adults are more vulnerable to mini-strokes or TIAs, let's dive into the most important part: the warning signs. Recognizing these early can literally save your life or that of someone you love. I want to introduce you to Robert, a 70-year-old grandfather from Wisconsin. Robert had always considered himself healthy and active, but one day he noticed something strange happening, subtle, brief symptoms that he almost ignored. Luckily, his wife convinced him to see a doctor, and they caught a mini-stroke just in time. Let's explore the signs Robert noticed and why they matter. 1. Sudden weakness or numbness, usually on one side. This is the most common and urgent sign. Robert felt his right arm getting weak and numb suddenly while watching TV. His mouth also drooped slightly on one side. These symptoms usually come on quickly and affect just one side of the face, arm, or leg. Why does this happen? Because the part of the brain controlling muscle strength and sensation on one side isn't getting enough blood. Even if the weakness disappears within minutes, it's a red flag telling you that the brain was starved of oxygen and a full stroke could be coming. 2. Temporary vision changes. Robert also experienced blurred vision and a curtain falling over one eye for a minute. This happens when the blood flow to the retina or the parts of the brain that process vision is interrupted. You might see double, lose sight in one eye briefly, or notice unusual shadows. Don't brush it off as tired eyes. These are serious signals that a stroke could happen soon. 3. Difficulty speaking or slurred speech. Suddenly, Robert found it hard to pronounce words and felt like his tongue was heavy. Speech difficulties or confusion about what others say can be caused by reduced blood flow to language areas in the brain. If you notice slurred, slow, or jumbled speech, seek medical help immediately. Early treatment can prevent lasting damage to your ability to communicate. 4. Sudden confusion or trouble understanding. Robert once forgot where he was for a moment or couldn't follow a simple conversation. Confusion, trouble concentrating, or memory lapses that come on suddenly might indicate a mini-stroke. This is often mistaken for normal aging, but a quick onset of these symptoms is a serious warning. 5. Dizziness or loss of balance. Feeling dizzy, unsteady, or losing your balance unexpectedly is a red flag. Robert experienced this once when getting up from a chair. It's caused by lack of blood flow to areas of the brain responsible for coordination. If you stumble, feel like the room is spinning, or have sudden falls, don't ignore it, get checked by a healthcare professional. 6. Severe or unusual headache. Though less common in TIAs, an intense, sharp headache unlike anything before can signal vascular problems in the brain. If accompanied by other symptoms like dizziness or weakness, this headache should be treated as an emergency. 7. Brief loss of consciousness or fainting. Robert had a brief episode where he felt faint and almost blacked out. This can happen if the brain's blood supply is severely but temporarily interrupted. Don't dismiss fainting spells or sudden extreme tiredness. They may be warning signs of a serious condition. 8. Tingling or pins and needles sensations. Finally, Robert experienced sudden tingling in his left leg that came and went. These sensations often affect one side of the body and can be confused with nerve problems. But in TIA, tingling means nerves aren't getting enough blood, signaling a potentially dangerous event. Why these signs matter? Each symptom represents a part of your brain temporarily losing oxygen and nutrients due to disrupted blood flow. Even if the signs go away quickly, they are urgent calls for help. Ignoring them risks a major stroke, which can cause permanent disability or even death. The takeaway: if you or a loved one suddenly experiences any of these 8 signs, don't wait. Call emergency services or go to the hospital immediately. Remember Robert's story. Early recognition and treatment gave him a second chance. 4. Risk factors that increase the chance of TIA. Now that we've talked about the warning signs, it's just as important to understand what puts someone at risk for a mini stroke, or TIA. Knowing these risk factors can empower you to take control of your health and reduce your chances of having one. Let me introduce you to Susan, a 65-year-old librarian from Colorado. Susan always thought she was pretty healthy. She didn't smoke, and she enjoyed gardening on weekends. But when her doctor told her she had high blood pressure and borderline diabetes, Susan realized that even subtle health issues can stack up and increase stroke risk. Here are the main factors that can increase the chance of experiencing a TIA, especially in older adults. 1. High blood pressure, hypertension. Often called the silent killer, high blood pressure damages the arteries over time. The constant high pressure causes the blood vessel walls to thicken and narrow, making it harder for blood to flow smoothly. This creates the perfect environment for blockages that can cause TIAs or strokes. Managing blood pressure through medication, diet, and exercise is one of the most effective ways to reduce stroke risk. 2. Diabetes. High blood sugar levels can damage the inner lining of blood vessels, accelerating the process of atherosclerosis. That's the buildup of fatty plaques. People with diabetes have twice the risk of stroke compared to those without it. Good blood sugar control and regular monitoring can help prevent complications. 3. Atrial fibrillation, irregular heartbeat. AFib is a heart condition where the heart beats irregularly and often rapidly. This causes blood to pool in the heart chambers, leading to clot formation. These clots can travel to the brain and block arteries, triggering TIAs or full strokes. If you have AFib, your doctor may prescribe blood thinners to lower your risk. 4. High cholesterol. Excess cholesterol contributes to plaque buildup in arteries, narrowing them and increasing the chance of blockages. A healthy diet low in saturated fats and cholesterol can help manage levels. 5. Smoking. Smoking damages the blood vessels, increases clotting tendencies, and raises blood pressure. Even quitting later in life can significantly lower your risk. 6. Obesity and physical inactivity. Carrying excess weight and leading a sedentary lifestyle increase the risk of hypertension, diabetes, and high cholesterol, all of which contribute to stroke risk. Regular physical activity, even light exercise like walking, can improve heart health and circulation. 7. Excessive alcohol consumption. Drinking too much alcohol raises blood pressure and can lead to heart rhythm problems, increasing the risk of stroke. 8. Age and family history. While we can't control our age or genetics, knowing your family's history of stroke or heart disease helps in risk assessment and prevention planning. Taking action. Susan learned that managing her blood pressure and blood sugar, quitting the occasional glass of wine, and taking daily walks made a big difference in her health outlook. She now keeps regular appointments with her doctor and feels empowered knowing she's actively lowering her risk. Remember, many risk factors can be controlled or modified. Awareness and proactive management are key to preventing TIAs and strokes. 5. Diagnosis and the golden hour for intervention. We've talked about what a mini-stroke TIA is, the risk factors and the warning signs. Now let's discuss how doctors diagnose it and why the timing of treatment, the so-called golden hour, is absolutely critical. Meet Linda, a 72-year-old retired nurse from Pennsylvania. Linda experienced sudden numbness and slurred speech that lasted about 20 minutes. Thanks to her medical background and quick thinking, she called emergency services immediately and went to the hospital. This quick action made a huge difference in her recovery. Diagnosing a mini-stroke. Diagnosing a TIA can be tricky because the symptoms often resolve before the patient reaches the hospital. Since TIAs don't usually cause permanent brain damage, imaging tests may sometimes appear normal. But doctors use a combination of methods to assess the situation: medical history and physical exam. The doctor asks detailed questions about the onset, duration, and type of symptoms, as well as risk factors. A thorough neurological exam checks strength, reflexes, speech, coordination, and sensation. Imaging tests. MRI, magnetic resonance imaging. This is the most sensitive test to detect brain tissue changes, even small areas of damage. CT scan, computed tomography. A faster test that helps rule out bleeding or other causes. Ultrasound. Carotid artery ultrasound checks for narrowing or blockages in the arteries supplying blood to the brain. Heart monitoring. Since heart problems like atrial fibrillation can cause TIAs, doctors often perform an EKG or longer heart rhythm monitoring. The importance of the golden hour. Time is brain. This phrase highlights that every minute without proper blood flow causes brain cells to die. For strokes, especially large ones, treatments are most effective when given within the first 60 minutes, the golden hour. While TIAs are transient, recognizing symptoms and seeking immediate care can prevent a full stroke from occurring. During this window, doctors can administer medications to dissolve clots or prevent new ones, recommend procedures to open blocked arteries, adjust medications to control blood pressure, heart rhythm, or cholesterol. Linda's prompt hospital arrival allowed doctors to quickly diagnose and start treatment, preventing a major stroke and giving her a much better chance for a full recovery. What you can do. If you or someone you know experiences any sudden neurological symptoms, even if they go away, call emergency services immediately. Don't wait to see if it will get better on its own. Early intervention saves lives and reduces long-term disability. Knowing the FAST acronym helps recognize stroke quickly: face drooping, arm weakness, speech difficulties, time to call emergency. Remember Linda's story. Time saved her brain and her future. 6. Treatment and prevention of TIA. We've learned what a mini-stroke TIA is, the risk factors, the warning signs, and how critical quick diagnosis is. Now, let's talk about what comes next: treatment and prevention. The good news is, with the right care and lifestyle changes, you can significantly reduce your risk of having a major stroke. Let me introduce you to Michael, a 68-year-old accountant from Texas. After experiencing a TIA, Michael worked closely with his healthcare team to manage his health. His story shows how treatment and prevention go hand in hand. Treatment after a TIA. Because TIAs signal a high risk of a full stroke, doctors take them seriously. Treatment focuses on preventing clots, improving blood flow, and managing underlying conditions. Medications. Antiplatelet drugs like aspirin help stop platelets from clumping together to form clots. For many TIA patients, this is the first line of defense. Anticoagulants, blood thinners. If you have atrial fibrillation or other heart conditions, your doctor might prescribe blood thinners such as warfarin or newer medications to prevent dangerous clots. Cholesterol-lowering drugs, statins. These help reduce plaque buildup in arteries. Blood pressure medications. Keeping blood pressure in a healthy range protects arteries from damage. Procedures. If tests show significant blockage in carotid arteries, major vessels in the neck supplying the brain, surgical options like carotid endarterectomy or angioplasty with stenting might be recommended to open up blood flow. Prevention through lifestyle changes. Michael learned that medicine alone wasn't enough. He needed to adopt healthier habits, heart-healthy diet, emphasizing fruits, vegetables, whole grains, lean proteins, and healthy fats like olive oil and nuts. Limiting salt, sugar, and saturated fats lowers blood pressure and cholesterol. Regular exercise. Even moderate activity like walking 30 minutes a day improves circulation, helps maintain healthy weight, and reduces stress. Quit smoking. Stopping smoking is one of the most effective ways to protect your blood vessels and overall health. Limit alcohol. Keep alcohol intake moderate to avoid raising blood pressure. Manage stress. Chronic stress can negatively impact heart health. Relaxation techniques, mindfulness, or counseling can help. Monitoring and follow-up. Regular checkups with your healthcare provider are crucial to monitor blood pressure, cholesterol, blood sugar, and heart rhythm. Adjusting treatments based on results keeps your risk under control. Michael schedules routine visits and follows his doctor's advice carefully. He knows that prevention is an ongoing journey, not a one-time fix. The takeaway: treatment and prevention of TIA is a partnership between you and your healthcare team. Medications, lifestyle changes, and regular monitoring work together to lower your risk of stroke and improve your quality of life. If you or a loved one has had a TIA, don't despair. Take it as a wake-up call and a chance to make positive changes. Like Michael, you can take control and protect your brain for years to come. 7. The role of family in caring for older adults at risk of TIA. We've covered a lot about mini strokes, their risks, warning signs, diagnosis, and treatment. But one crucial piece we shouldn't overlook is the role families play in supporting older adults who are at risk of TIA or recovering from one. Meet Carol, a 69-year-old grandmother living in Oregon. Carol's daughter, Emily, became her strongest advocate after Carol experienced a mini stroke. Emily's involvement made a huge difference in Carol's health journey. Let's explore how family support can be a game changer. Recognizing the signs together. Older adults sometimes downplay or dismiss symptoms like mild weakness, confusion, or dizziness, thinking it's just part of aging. Family members like Emily often notice subtle changes first, a slurred word here, a stumble there, and can encourage prompt medical attention. Being aware of the 8 warning signs and understanding their urgency empowers families to act quickly. Encouraging healthy habits. Families can help by promoting lifestyle changes that reduce stroke risk. Preparing nutritious meals rich in fruits, vegetables, and whole grains. Inviting loved ones for walks or light exercise to keep active. Supporting smoking cessation or limiting alcohol intake. Helping with medication schedules to ensure adherence. Emily found that making these changes a shared family activity made it easier and more enjoyable for Carol. Providing emotional support. Experiencing a TIA can be frightening and stressful. Emotional support from family, patients, encouragement, and understanding helps older adults feel less isolated and more motivated to take care of their health. Emily often reminded Carol that she was not alone, attending appointments together and celebrating small victories in her recovery, assisting with medical care, helping with transportation to doctor visits, keeping track of medications, and communicating with healthcare providers are vital roles families can play. This practical support ensures consistent management of risk factors and timely follow-up, advocating for prevention and safety. Families can also advocate for regular checkups, screenings, and early interventions. Sometimes, simply being involved and asking questions can make a big difference in the quality of care. Family involvement isn't just helpful, it's essential. Older adults with TIA risk need a network of care that extends beyond the clinic. Like Emily and Carol, working together creates a stronger, safer path toward health and well-being. If you have an older loved one, take the time to learn, watch for warning signs, and be their partner in prevention. Your support could save their life. In life, sometimes the smallest signs carry the greatest messages. A fleeting numbness, a brief lapse in speech, a momentary loss of balance, these aren't just random events. They are your body's urgent way of telling you, pay attention. Act now. Remember Robert and Linda's stories, ordinary people who listened, acted, and changed their fate. You or someone you love could be next. Don't let these precious warnings slip away unnoticed. If you or a loved one experiences any of these 8 warning signs, don't hesitate, call for help immediately. Early recognition and prompt medical care can mean the difference between a full, healthy life and a lifetime of disability. Please make sure to subscribe to our channel and hit the notification bell so you never miss important health updates like this. Share this video with your family and friends. Awareness is the first step to prevention. Let's commit today to awareness, caring, and action. Because when it comes to strokes, every second truly counts. Stay informed, stay vigilant, and above all, stay hopeful.